Welcome everyone to preparing for Diabetes Care and Education Specialist Exam, known as CDCES. I'm Beverly Thomassian. My pronouns are she, her, and hers. I'm the president of Diabetes Education Services for the past 26 years, and I've also taken the CDCES exam over 6 times. Now, you might wonder, why would anybody take an exam every 5 years to renew? Because you can renew through CEs. I actually choose to take it every 5 years because I want to know what's on the exam so I can share it with all of you. And not that I'm going to give you the nitty-gritty details. It's about what is the philosophy of the exam, how do you plan your limited study time to succeed, and what are some tips that might help you get to that best answer. So I'm so happy you're here, whether you're listening live or recorded. This is our website, and just some orientation to our website. These are the drop-down tabs where you can find your direction, and I would just start here with free. We have so many free webinars, free resources, free pocket cards, free CDCES coach app, and that's because we're a value-based company, and we believe in diabetes education so much, and I believe in the power and the capacity and in the importance of diabetes education to improve the health of our community. And we want to provide you with resources that you can bring back to your clinical practice to improve care and share with your colleagues. We have pocket cards. Now, the pocket cards are really amazing. I'm going to grab mine. And that is, they have all the different medications that are available, current diabetes medications. We have a printed version, and you can see it's 8 sides. And the reason we have a printed version, because you want to carry it in your pocket. In my clinic, where I work on Fridays, I work in Indian Health Services. These are our hot ticket items, and they often leave the office. Where did they go? Nobody's sure. So I bring backup supply. But it's so handy, especially when we're talking to people with diabetes about the medications they're thinking about trying. And then I also have a glucagon pocket card, which goes over the different availability of the glucagon injections, and also the powder version and the dosing, plus a teaching side for people living with diabetes. This is our support staff, Brianna and Tiffany. They are in charge of customer happiness and also making sure everything is running smoothly on the back end. If you reach out to us, call us, email us, we will pick up the phone. And if we don't, we will call you back or email you. We really want to provide outstanding customer service. So I'm so fortunate to have this amazing team, and I'm thankful every day. Before we get started with the content, I always like to kick off with a land acknowledgement. We acknowledge and are mindful that Diabetes Education Services stands on lands that were originally occupied by the first people of this area, the Mechoopda, and we recognize their distinctive spiritual relationship with this land, the flora, the fauna, and the waters that run through this area. There's other resources for this exam that we have available for you. Here's our app and our study tools. And if you go to the homepage of our website, it will say Get Started. There's a big Get Started button. You can press that and it will start you on your journey. But we also have this book. It's the review guide, and the review guide is 480 sample test questions, and it's published by ADCS. And the test questions also have a rationale for them. This is a great way to assess your knowledge and see, oh, what am I really strong in diabetes? What are areas that I might need to fill in some knowledge gaps and, kind of prepare for that exam situation. I'm going to get one more book for y'all. This is the desk reference, and this desk reference is 800 pages, and it has all kinds of information on like special populations, people during pregnancy, adolescence, older folks. It has a lot of pharmacology information. It has information on screening and complications, and a lot on behavior change. So really great book if you're thinking, gosh, I'm a reader, I like to read. That might be a choice for you. And then lastly, I just really need to share the standards of care. So the standards of care published by the American Diabetes Association will help you immensely in succeeding on this exam. And it's over 200 pages of information. It's a lot of content. So you can read this, and it's also in our app, the standards of care. I also have webinars that break down the standards of care and make it a lot more understandable and help you figure out what is most important to focus on. And so we really want to meet you where you're at. Some of us like I really am a big reader. I love reading. Some of us like to hear information, as you all know, and some of us, want to be like engaged and interactive and be live and in person. So depending on your style, you can try these different avenues. Oh, yeah. If you want to be live and engaged, come to San Diego because there's 3 of us teaching our diabetes educator course. Myself, Dr. Diana Isaacs, Ashley Lebrier, an amazing dietitian. And you could see this was from a few years before COVID, but it's just a beautiful location. We go through the standards of care and content that will be very helpful for the CDCES exam. And gosh, we serve great food and we kind of spoil y'all. I want to say that you do get spoiled. Plus you get CEs and breakfast and lunches included. So what are we going to talk about today? Well, what are some of the updated definitions? What does the new exam look like? What are the eligibility requirements? What's on the exam? What's in the exam? How do you study for it? And what are some tips to help succeed? Because I know y'all don't have unlimited hours to study. We have other obligations. So how do you work this into your life? I need to say that this is a certification board for diabetes care and education specialists, CDCE. They're the ones who administer the exam. And I need to give a disclaimer that I have no relationship with them. They don't give me any insider information. They don't call me and say, hey, Bev, make sure and include this information. No. How do I get the information I share with you? It's just from my own review and study and my experience, of course, taking the exam every 5 years. Here's their website. They have a lot of great stuff on their website, so you can check that out. You can ask them questions. They have a Facebook page. So a real nice place to kind of evaluate if this is a direction you want to go, and if you're already committed, this is where you sign up for the exam. So a lot of the information I'll be getting from the certification examination handbook that's published by the CDCE. We have it on our website, or you could go to their website and get it. But I want to kick it off just talking about how is a CDCS defined? And you might be wondering, why is that important? It's actually really important because you want to have the right philosophical framework as you sit for this exam. This exam, you're not wearing your white medical lab coat and your stethoscope. You're wearing a coaching cap. Because we're supporting people in making behavior change. That's really important to keep in mind. And we're always going to start with that individual. We're going to keep it person-centered. We're going to start where they're at. Just holding that in your space as you're looking at the questions and answers will help you choose, 10 additional correct answers. So what is a CDCS? It's a healthcare professional who possesses comprehensive knowledge and experience in diabetes prevention, prediabetes, diabetes management. So look at this, preventing diabetes if somebody has pre, and if they have diabetes, we're going to help prevent complications and help get to best quality of life. We educate, support, and advocate for people affected by diabetes throughout the lifespan. I think this is the hardest part of the exam, is that it's from birth to death. We have to be knowledgeable about the different phases of life during pregnancy, in the hospital, out of hospital, in clinic, in community. How do we manage diabetes in these different situations and different locations? And how do we adjust how we present information or connect with people based on where they're coming from? We promote self-management to achieve individualized, just circle that word, behavioral and treatment goals that reduce risk and optimize health outcomes. So reducing risk, optimizing health. And you might wonder, why take this exam? And I'll just go cut right to the chase. It's the best professional decision I've ever made. Having my CDCS helped me get a job. I worked in the HMO. I was doing chronic disease management and also health education classes. And then also I got a job at Stanford Hospital with my RN, my MPH, and my CDCS. I became the inpatient diabetes specialist. And then after I left Stanford because I got married and moved to Chico, I actually was able to work as a consultant setting up an ADA recognized program up in Paradise. And that burned down in the campfire. So then I shifted, I pivoted, and now I work at Indian Health Services as the diabetes nurse specialist there, providing individual care and consulting with providers. So I'm a consultant to the providers. And it just opened doors in many different arenas for me. It allowed me to open my own company and provide this information for you. So you can't go wrong with it. It's very reasonably priced, and it's well recognized in the healthcare community. It provides formal recognition, specialty practice, and mastery level knowledge. This is not an exam you could just read a book and then take the exam. You have to apply the information for at least 1,000 hours. And that application of information plus having the book knowledge together really is I don't know, it's so terrific because we're going to take this evidence-based information, we're going to translate it to understandable terms for the people that we serve, and we're going to improve care through that connection with that individual. We promote continuing commitment to best practices, current standards, and knowledge. Like, for example, just having this position in the clinic where I work, since I know the standards of care, I could share them with my colleagues. It elevates the practice of everyone. So in order to take this exam, you need to have at least 2 years to the day of professional practice experience under your licensure, your discipline, plus 1,000 hours of professional practice experience within the past 5 years, of which 200 hours have to come from the last 12 months. And this is highlighted. It used to be 4 years, and it used to be 400 hours, but because of the pandemic, they gave them more time to complete these hours, and they reduced the number within the last 12 months to 200 hours. Plus, you need 15 clock hours of continuing education within 2 years. And all of our courses that we offer meet this requirement. Our CEs count toward these hours of CE that are needed. So this is right from the CBDCE, the standard pathway that if you have kind of the usual licensure to sit for this exam, you need at least, this was prior requirement, it used to be 400 hours over 12 months, but now you need at least 200 hours of diabetes care and education management within the last 12 months and 1,000 hours within the 5-year period. So that is starting in January and will go on in perpetuity. So they changed that requirement, which I think is terrific. Now, if you're doing unique qualifications pathway, maybe you have a master's degree in a health-related field, but you don't have RN, RD, PharmD, they kind of, I would call it typical licensure that people move forward with. Then you would need at least 2,000 hours. So it's a big ask. It's a big ask. We have a lot of exercise physiologists take this path and other healthcare professionals that may not fall under the standard pathway, but fall under unique qualifications pathway. So you want to, if you're doing unique qualification pathway, you want to check in with the CBDCE ahead of time to make sure you're on the right path. You want to pre-qualify. So the hours only count once you get your licensure, this 1,000 hours, and unique qualification, 2,000 hours. So once you have your degree, once you have your licensure, you can't do it when you're doing your training component. And of course, if you have more questions about that, the CBDCE is the ultimate authority. Let's do a poll question. Diabetes care and education exam includes which of the following philosophies? A, encouraging compliance improves outcomes. B, empower people to improve diabetes self-management. C, consider individual needs, goals, and life experience. D, help all people, I'm gonna launch the poll because there's a little delay. Help all people achieve an A1C of less than 7%. E, collaborate and provide ongoing care. So you can choose more than one. This is just kind of to generate a conversation. So certainly you can choose more than one of these, but what does a diabetes care and education exam philosophy include? And this, like I was saying, that having that philosophical framework in mind before you step into this exam is going to help you so much. And if you have questions, you're welcome to type them in, and I'll kind of keep an eye on the questions. And if they fit right into what I'm saying, I'll address it. But all questions I'll answer after class. We'll take a few more seconds. All right, I'm going to close the poll. Thank y'all. And share your results. 24% of you said A. So let's take a look at A real quick. Encouraging compliance improves outcomes. Generally speaking, we move away from compliance. And you don't know this yet. So I'm so glad, we're here and we're talking about this information. We don't even use an adherence model. We use a person-centered model where we say, hey, what is this person doing right, doing well? What action are they able to take within their social determinants of health? Compliance says they need to be doing A, B, C, and D, and if they don't do it, they're non-compliant. We've moved away from that model. We've left it by the wayside. It's a traditional model that didn't serve us well because it really does infuse the meeting with shame and blame. And we want to move away from shame and blame and move toward empowerment and looking at what the strengths they bring to the situation. Okay, so if you have any questions on the exam that kind of lean in that direction, you want to move away from that compliance model. 94% of you said B. Absolutely, we're going to empower people to improve their own self-management. Diabetes is really a self-managed condition. 76% of you said C. That 100% of us would say that. Yes, we always start with the person's values, their needs, their goals. We consider social determinants of health. We keep it person-centered. We start where they're at. Just holding on to C will help improve your score. It's such an important part of this exam. 12% of you said D. Great job, because we know that when their answer has a word all in it, probably not the best answer, because we have to individualize with diabetes. We want to help people achieve the A1C goal that matches their values and what their goal is. So even with the A1C, yes, the national goal is less than 7, absolutely, but we customize it based on that person's situation. I'm just going to say one more thing about that. So what if you have an older person who's living alone, they're on insulin? I might want that A1C to stay 7 to 7.5 or 7 to 8. What if I have a person who's on metformin, SGLT2, they're a 25-year-old with type 2. If they're on those 2 meds, they're at no risk for hypoglycemia. I might want to push that A1C less than 6.5 if that's what they want. It always starts with the person. Okay, so E, I would close this, is also 71% of you chose that. Great job. Yes. Collaboration is a big part of what we do. We collaborate with other professions, with our colleagues. We collaborate with the person with diabetes and their social network. And diabetes lasts a lifetime. And so we're providing care from birth to death. We don't discharge people unless they move away. We are going to keep connected to individuals with diabetes in our community. Okay, great job, y'all. Let's keep going. What is a definition of diabetes education? So it's a component of a comprehensive plan of care. So the medical provider will manage the medical care of that person, and we're providing support to the provider. So we might encourage different interventions. Like we might say, oh, let's make some adjustments in nutrition therapy and activity and medications. Absolutely. We're involved in that way. And we're also saying, oh, maybe we need some screenings. We need to look at their feet. There's having foot issues. But it's this collaboration and connection with the person with diabetes, provider, and ourselves. It's an ongoing process of facilitating knowledge, skill, and ability necessary for self-care, as well as helping the person with diabetes implement and sustain health practices to manage on an ongoing basis outside of this training that we do. We understand that diabetes is a self-managed condition. We want to provide people with the information, knowledge, skill set to manage it successfully. It's a process that incorporates the needs, goals, and life experience of the person. We recognize the expertise of the individual. Who knows you better than you? So we want to leverage that expertise and bring it forward and help them utilize that to meet their goals. And anything we share is going to be based on evidence. And I just give this example is when I first started in diabetes over 30 years ago, I used to give tear-off sheet to people with all the foods they should no longer eat. Yeah, I was shitting on people, which is not a good idea. So we don't should anymore. And we don't give lists of stuff they can't eat. It wasn't even based on evidence. Now the ADA says you can incorporate foods with sugar into the diet and the meal plan, and just keeping an eye on the blood sugar. Of course, it's not unlimited, right? We encourage people to eat healthfully, but saying you can't eat certain foods doesn't match our philosophy of diabetes care anymore. It includes practical problem solving and collaborative care. And then, of course, we have to look at distress. Looking at the emotional impact of diabetes on a person's life is so critical. We cannot overlook that, because if distress is not addressed, they may not be able to sustain self-management. And I've touched on a lot of this already, but this is, again, a critical part of exam success, but, way bigger than the exam is the success we have with the individuals we serve. Instead of you got to control your diabetes, we manage it. We don't test blood glucose, we check it. Test is pass or fail. I really don't use the term patient or a diabetic patient or diabetic. We say a person with diabetes, a participant, an individual living with diabetes. If your blood sugar's not normal, what are you? Abnormal? We just move. This language carries stigma with it. We want to move away from the stigma. And the language we choose to use with people with diabetes instructs that person with diabetes how to talk to themselves. Because people with diabetes can be very self-critical. So when we help change the conversation and use these more empowering words that focus on their strengths, they bring that into themselves. It's just a wonderful opportunity for us to change that inner dialogue. We ditch non-adherent, non-compliant, focus on what they are accomplishing. So I'm doing a whole webinar today on this topic. I'm very passionate about it because it makes such a big difference in the person with diabetes life. It makes a difference in our lives because it's a more fulfilling way to have a conversation. So you can join us tomorrow. And if you can't join live, you can listen to the recorded version. This webinar, surprisingly, will help you succeed at the exam because it puts you in that right frame of mind of what they're looking for as far as best answers. I just want to say one more thing. So if you go to our website, diabetesed.net, and just press the free carrot, because the free carrot is a good place to start, all these free webinars drop down. And all of these free webinars, you could click on it and start listening immediately. I have them all recorded, ready to go, because I believe in this content. I believe in sharing this information. And then we have our newsletter, we have blogs, we have question of the week. It just goes on. We have a lot of great cheat sheets. So we're committed to sharing that with all of you. Okay, so here is the qualified occupations to take the exam. And if you don't fall under one of these, you would go under here to see if you need to go to the unique qualifications pathway. Then you want to see, have you had your experience in the US? Do you have, your CEs? And do you meet all the criteria? If you could say yes to all of these, and this is right from the guidebook, you're ready to apply. So how do you apply to take the CDCES exam? Well, you go to that website, CDCE, and you start the process there. You'll have to create a login and just move through the steps. But when you do apply, you'll receive a notification that you've been approved to take the exam. Thank you very much. Set your time and date, or you might be selected for an audit. Now, it's okay if you get selected for an audit. They're not singling you out in any way. They don't ask everybody to submit paperwork, so they just ask a random group of people. And then what you're going to do is you're going to submit a copy of your licensure, documentation of professional practice experience. Now, this is where you're documenting you're doing diabetes self-management education. And so during the day, you just want to think about how many hours do I spend doing DSME. You don't need to write down individual patient names or exact minutes, but the charting on a person, reading their chart beforehand, communicating with providers, with pharmacies, talking to that individual, all of that counts. Preparing curricula, preparing worksheets, all of those hours, all of the time spent doing that counts towards your hours. So yes. And the supervisor verifies. So if your supervisor signs off that you've completed those hours, that's attestation that yes, you've completed it. It is not questioned. You need CE course verification and then employment verification signed by your supervisor. So just have this ready when you apply to take the exam in case they ask you, you can submit it easily. Now, the test is really great because you can take it on an ongoing basis. Before, you could only take it a few times a year, but now you could sign up at any time. Once you get your application approved, you need to sign up within 90 days to take the exam at a site of your choosing. Now, you don't have to go to a site, but if you do go off-site to a testing center, just sign up early because you want to get, the best site and they fill up quickly. And to take the exam, as I mentioned, you're going to register through CDCES. This is a new process. It used to be a little bit different. So they had a vendor they were using and they've shifted vendors and the process a little bit. So you need to create an account with them and then take your exam within 90 days. You have two choices. You can go to an exam testing center or you could do live remote proctoring. Live remote proctoring means you use your own computer from home. Now, that sounds pretty cool. Yeah, you have to download some software and you have to check in a little bit earlier, like a half hour, an hour before your actual testing time to make sure everything is working correctly. And you need to have a webcam on the entire time because they need to see everything you're doing. So there's going to be somebody monitoring you. You need to make sure your webcam can evaluate the room. And you need a quiet room where people aren't coming or going or dogs aren't barking because if there is noise or somebody enters the room, you may be disqualified. There is a calculator built into the program, so you don't need to use a physical one. But here's the real deal breaker for some people. You are not allowed any breaks during your exam session. That means you cannot use the restroom. You cannot leave the webcam. You have to be like really limited movement because they need to make sure you're not accessing answers from somewhere. So that's just a real limitation of this live remote proctoring. Once you're done with the exam, whether you're taking it at a testing site or live remote proctoring, the results will pop up on your screen upon completion. So it will say, yes, you have passed. And then they'll send you an email with more details. When do I get my results? Well, this is really great news. Even though they just changed the exam July 1st, people that are taking the new exam are getting their results right away. So you're going to get the same day. You're going to get that pop-up, yes, telling you that you've passed or whatever the outcome is, and then they'll send you via email more detailed information. And you can retake the test as many times as needed. The first time you take the exam, it's $350, and the renewal is $250. So renewal of $250 for 5 years, that means it's $50 a year. Man, that's a great investment in your professional career. Very, very reasonably priced and worth the effort. How do they score the exam? Well, you're going to get a raw score and a scale score, but you really want to focus on the scale score to pass. You need 70 scaled score units. Now, I'm just going to describe what that means a little bit because there's different variations of the exam, and they do that, of course, to limit cheating. And so if you are in a room with 3 other people, they all have different variations. How do you know that theirs is the same difficulty as yours? Well, because each question is weighted, and some questions might be weighted 1, they're super easy. Some might be more difficult. They get a scale point of 3. And that way there's an even distribution of the difficulty of questions in each exam. So when you want to look at your score, you want to look at the scaled score units. So you might be wondering, what's the passing rate for this exam? And through 2021, I couldn't, and 2022 actually, and I couldn't get any more recent data, it's about a 67% pass rate. So it's very consistent over the past decade, where about 67 to 70% of first-time test takers pass the exam. What does that tell you? It tells you it's a hard exam. It's not easy. You have to study. You have to prepare for this exam because you want to be in that 70% pass rate. But what if you're not? It's totally okay because you can retake it again. Sometimes we put a lot of pressure on ourselves. And I know that you're a super achiever, because who else would take this exam besides a super achiever? We don't need the certification. Maybe you have a passion. This is actually a passion certification. For some reason, you have a passion for diabetes care and management. You want to improve diabetes care. I love that. I'm so glad you're here. But, so we want to be gentle and kind to ourselves as we go through the study process. Questions are linked directly to a task or a task. And each question, the test writers are very sophisticated, and they want to figure out, does the candidate possess the knowledge to perform the task or has the ability to apply it in a job situation? That's why they use a lot of vignettes. So vignettes are these very wordy paragraphs about a person with diabetes, and they have A1C and the lipids, and they have the social determinants of health included. And, ultimately they ask you, what would be the best action? So you have to kind of read through that. They're trying to put you in that room with that individual to figure out what is the best approach. Of the 175 questions, 25 are new, but they're not counted. They're just evaluating the questions. So your total score is only based on 150 questions. If you notice, you have a really awkwardly worded question or a question that seems kind of odd, it might be one of those they're evaluating to see how people respond to it. So do your best and then just let it go. I'm going to ask you another question. What are some study strategies that will help you succeed? A, focus your study time on topics you are confident in. B, take as many practice tests as possible. C, read as many books on diabetes as possible. D, develop a study plan and block off study time. E, teach the content to someone else. Which of these study strategies will help you succeed, given your limited time and your other commitments? And there's more than one right answer, as you all know. All right, you all are superstars here. I love what I'm seeing. I'm going to close the poll and show you results. So 11% of you said A and 22% of you said C. So let's talk about A and C. You want to focus your study time on topics you are less confident in. So like as a diabetes nurse, I'm really confident in pharmacology. I know the meds really well, but I don't get to work with people during pregnancy that much. So that's my area of least confidence. So I might want to study meds because I'm like, oh yeah, meds. I feel really good studying those. And I might avoid diabetes and pregnancy, but we're going to try and do the opposite. And that is move into the areas that give you anxiety. When you think about it, you kind of feel overwhelmed and maybe your heartbeat increases a little bit. Move into those first, then go back and study some stuff you're confident in, just to give yourself a little reassurance, because this is not easy being an adult learner. It's not easy being vulnerable and saying, I don't really know that much about this topic, because we're healthcare professionals and we feel like we should know this stuff. Why would we know that? It's so vast. Diabetes is so big and vast. So be kind and gentle to yourself as you go through this. So we're going to focus our time on stuff we don't know. And then for a little reassurance, we'll reflect on the content we're confident in. Now, take as many practice tests as possible. 78% of you chose that. Absolutely. We want to increase our test-taking muscle. 23% of you said read as many books on diabetes as possible. I would not do that before the exam. I love your enthusiasm, but it might be overwhelming and you may not know what to focus on, and the books might conflict each other. So I'm going to just share with you what resources I would focus on. And then after you get your CDCS, read everything. I love that. Okay. D, develop a study plan. Yeah, you tell, your people, I love you, but I'm working on this goal. I really need your support. I'm going to be studying on these days from this time. I really need the space. Thank you so much for giving me, believing in me to make this happen. And then, of course, teaching the content to someone else. Wow, I learn so much when I teach. It's my best opportunity to learn, what don't I know and what do I know? So you can teach it to your dog or your cat or, somebody who will listen, maybe you have students, and just get comfortable with the content. We have a test-taking toolkit, which has 220 sample practice test questions. It's only $49. I love this because these questions are taken from the standards of care and other areas that appear on the exam. So it gives you a chance to do a computerized test, which is super helpful. And then you could time yourself, see how long you take per question. You want to take around a minute per question, maybe a little bit more. And then you could get, have that comfort of moving around through a computerized exam. I just think it's really helpful. I have a free webinar on test taking that you can listen to where I dissect the questions too, like how to get to the best question and answers. So the exam is now 175 questions. It was 200, and you get 4 hours. You still get 4 hours to complete the exam, and they have a new exam outline that's implemented starting in 2024. So there's a lot of questions on assessment, but there's 37 questions on assessment. And assessment is that time when we sit across from that person with diabetes and hear their story, find out what's working and not working. And you can see there's 12 questions on physical and psychosocial, their health history, physical assessment, social determinants of health is going to come up a lot. Living situation, healthcare access, social support, food, housing, and security. We always think about that person in the context of their environment where they live and work and pray and eat and play outside of the office setting or wherever we see individuals. Self-management, behavior and knowledge, disease, eating habits, activity, medication, monitoring, technology, and then learning. What are the goals and needs of the learner? What is their readiness to learn? And I got this right from the handbook. So this is just excerpted from the handbook, and you can go through it. And what I would suggest to you is to go through all these different bullet points and figure out how knowledgeable am I on these topics, and give yourself a ranking of 1 to 5. 1, not very knowledgeable. 5, I'm a superstar. And then see, if it's less than 3, areas that you maybe want to prioritize studying early on to really let that information percolate. Care and intervention is the most questions, and that's a big shift. They moved the majority of the question to diabetes care and education interventions. And there's 105. Disease, process, and approach to treatment, there's 22. Individualized education plan, 17. Person-centered education on self-care behaviors, 58. So we can look through these, but pathophysiology, figuring out based on our assessment, what is this collaborative plan we're going to make together? And then what about nutrition principles, physical activity, med management, monitoring, evaluation, and I'm just going to keep talking on this list. Acute complications, chronic complications, problem solving, living with diabetes, evaluation, documentation, and follow-up is 8. They lay it out so beautifully so we can look through and see, where do I have a lot of knowledge? Where do I need to study more? And I actually created an Excel database where I went through each one of these lines and I figured out, do our online courses cover this content? And the good news is they do. So we have a CDCES prep bundle that addresses this content. We verified it, and that was so reassuring to me because I want to make sure our study tools and materials will help you on the path to success. So standards and practices used to be a lot more questions. It's only 8. And this is where we are familiar with the national standards, prevention program, how we, the importance of advocacy, inclusion, diversity, and equity, and looking at social determinants of health. So SCOH shows up a lot. That's a big pivot. And we are here to help you earn that CDCES after your name. And as I mentioned, I've evaluated our programs, and whether you take our CDCES prep bundle, or you come to San Diego, or you take the virtual conference, which comes along with a free bundle of courses, we address in our content the areas included in this updated exam. So be reassured, you're in the right place. And, I've taken the exam so many times, it just feels like it's part of my DNA now. And I love this picture, it's so beautiful. As far as what to study, I was mentioning, do you want to read all the books in the universe? No, these are getting started places. And I've talked about the standards of care. I mean, you just have to read this, or you could attend our online courses on the standards of care. That's right here. So you can get a PDF of it. Some people want the book. Also, I have these cheat sheets that are super helpful. Screening and diagnosis, pharmacologic approaches to diabetes treatment. That's the ADA. Language and diabetes resource page will help you so much. I'm doing that webinar tomorrow, but you can always watch it free. I have a really great cheat sheet on cholesterol and hypertension medications. And I do want to say, the exam is not going to ask you a ton of details on blood pressure and lipid medications, but we need to know when to use them, when it's appropriate, and what classes we would choose. The 7 self-care behaviors we want to be familiar with, and then the ACE algorithm. To get to this page, all you need to do is click on this QR code, or you can go to free resources and it says CDCES webinar. That's where you would go. And this is at the very bottom under read more recommended articles. Okay, taking the exam. We're doing good. We have about, we're going to go over the test questions now. Keep it person-centered. I could say this a million times because it's so important. But when you're looking at the questions, choose the answer that is most person-centered. Focus on psychosocial needs and social determinants of health. Start where the person is at. Keep their characteristics in mind. And we are supporting efforts toward behavior change. Now, to increase success, if the answer you wanted isn't there, it's okay, let it go. Pivot, breathe, readjust. So you have this answer in your mind and it's not there, take a deep breath. Give yourself the opportunity to look at the question from a new angle, from a fresh angle. Don't overthink it. Don't add stuff in. It's so easy, like, oh my gosh, I had a person I saw that was just like that. And then you add in these details that are not there. Just use what you have. Make sure the answer you choose fits the situation. Okay, they're going to have juicy answers. Juicy answers are defined as answers that are so comfortable you want to hang out with them. You want to sit on the couch and watch a show. They're just like, they provide you with like, oh yeah, that just sounds so good, but they don't match the intent of the question. There's going to be juicy answers there. Let them stay on the page. You choose the answer that matches the intent of the question. Always use national goals, not the goals from your work. When you get those vignettes, it's going to seem like a wheat field, and that wheat field is going to be vast. You might feel lost, but it's okay. Take a deep breath and go, what are they really trying to ask me? Read all the options or answers, get rid of false answers, and then get to the best option. It doesn't say the right option. It says the best. You're going to eliminate 2 false answers, and then you're going to be left with 2 answers, and you're going to be like, what's the best? There always is a better answer. Is it patient? And you want to make sure it's a person-centered answer. Look for clues in the answers. If they have the following words, they're usually not the best answer. But if they have these words, seldom, most, generally, tend to, probably, usually, they're usually correct. So move toward those answers. Also, don't leave any answers blank. Look for clues in the question. Don't get lured in by juicy answers. Oh, your life experience, while it's very important, and we use life experience in all these questions and common sense, but you don't want to alter the intent of the question with your life experience. If you're at a testing center, you can breathe. I mean, Whether you take it live or at the testing center, you can breathe either place. It's totally important. But getting up and moving is more likely in a testing center. You can use the bathroom, you can get up and move. They will not penalize you for that. If you have test anxiety, and if you do, have a plan for that. Making sure you have enough, food in your stomach and you've got enough sleep and whatever else you need to do to provide yourself with a sense of calm, especially if you get anxious during the exam. What are you going to, what action can you take to calm your anxiety? It's really important. And you got this. Even simple math problems should be worked out on scratch paper. Okay, so finally, we made it. We made it to our first question. And what we're going to do is read this together, and then I'll launch the poll and choose what you think is the best answer. A patient is admitted to the hospital with elevated glucose and a strong family history of diabetes. They're started on fluid replacement and placed on a clear liquid diet. Her dad is in the room and is very concerned. Which of the following would suggest a diagnosis of new onset, type 1 versus type 2? And I'm going to launch the poll. Is it A, hyperglycemia, B, polyuria, C, ketosis, D, polydipsia? So person is admitted to the hospital, blood sugars are elevated, strong family history, started on fluid replacement, on clear liquid diet. Her dad is in the room and is very concerned. Which would help us figure out whether they have new onset type 1 versus type 2. And again, get rid of false answers and then get to the best answer. And if you don't choose the best answer, it's totally okay, because this is a learning situation where you're very safe, and it just is going to help you figure out where you have knowledge gaps and where you have knowledge strengths. So this assessment of your own knowledge is so helpful to help determine your study path. I'm going to close the poll, and I am so impressed because 94% of you chose ketosis, 6% of you chose polydipsia. Great job. And I was going to say, I'm going to cut to the chase. Ketosis is the best answer. So there's a lot of information here, but the intent of the question is a differential between type 1 and type 2. So with type 1 diabetes, so here's a pancreas. This is how our pancreas looks when we're born, with lots of beta cells. But with type 2 diabetes, we have less beta cells, about 30% of our original amount. And type 1, we have none, no beta cells left. So when we have type 1 diabetes, we don't make enough insulin, and we don't make enough insulin, we can't use glucose for fuel. And when we can't use glucose for fuel, we start using fat for fuel. And when we use fat for fuel, it leads to ketones. So that's how we differentiate, because a person with type 2 can still make insulin. So they're unlikely to go into ketosis, but people with new diabetes can all get hyperglycemia, polyuria, polydipsia. That can be an expression of hyperglycemia, type 1 or type 2. But the only one that is differentiating is ketosis, because that's associated with type 1. Now, what if you didn't choose that? It's okay. It just tells you, oh, I need to study a little bit more on the pathophysiology of type 1 versus type 2. That's it. There's no judgment here. Okay, let's do sample question 2. MJ has type 1 diabetes and wants to know the possible complications that can result from hyperglycemia during the first trimester of pregnancy. Which of the following complications can result from first trimester hyperglycemia? A, macrosomia, B, vascular defects, C, shoulder dystocia, or D, spina bifida. MJ has type 1, wants to know the possible complications that can result from hyperglycemia during first trimester of pregnancy. Which of the following complications can result from first trimester hyperglycemia? And I'm just going to say, I love the way I'm doing this right now. I'm going to give myself some props. No, I read the question, I read the answers, and I went back and read the question. That's how I would suggest you do it too, if it feels comfortable for you during the exam. It just really helps you get focused on the intent of the question in a very clear way, and then get to the best answer. You may not work in diabetes and pregnancy. It's all right too. Use your common sense for all the questions. Use your common sense and your clinical knowledge. Okay, I'm going to close the poll. Show your results. 44% of you said A, 25 B, 31 said C. Okay, let's take a look at this question real quick. Really straightforward. They have type 1 and wants to know what complications can result from hyperglycemia during first trimester of pregnancy. So that's the intent of the question. And let's just think about this. So during the first trimester, what is happening to the fetus? The fetus is growing its organs. That's the job of the first trimester, the organogenesis. Now, we know that the mom's glucose can pass through the placenta, but insulin does not from the mom to the baby. So that glucose is going to be affecting fetal development. And if the baby during the first trimester, or the fetus during the first trimester is exposed to a lot of glucose from the mom, it can actually disrupt organogenesis or development of the organs. And that's what the question is saying. It's not saying what happens during delivery. It's saying what can happen during the first trimester. And so when we think about diabetes and pregnancy, we might go, oh my gosh, I don't really know that much about it, because it's true. It's a very specialized field. So not many people have exposure to it. But just take a deep breath and go, wait, I'm going to go back to basic pathophysiology. I got this. You want to coach yourself like that. So macrosomia is big baby. Is that a complication during the first trimester? No, because we're just growing organs right now. Vascular defects is what I would call a juicy answer, but it's so vague. What does it even mean? It's kind of just there, like, oh, but it's not the best answer. A shoulder dystocia, that's when we have a larger baby coming through the vaginal canal that might dislocate their shoulder. No, that wasn't an answer. Nobody chose that. Great job. Spina bifida is the best answer because there's incomplete closure of the spinal column. So that makes sense because the fetus is being exposed to extra glucose, so it's disrupting organ development and it can cause congenital anomalies. Now, what if you don't know that much about diabetes and pregnancy? Well, the standards of care has a whole standard dedicated to it. Also, we have an online course dedicated to diabetes and pregnancy. That big book that I showed you, we call this the desk reference. It's heavy. It has a whole chapter dedicated to diabetes and pregnancy. So you can fill these knowledge gaps in many different ways. Okay, let's keep going. We're going to do a vignette style question. We have a 47-year-old man with newly diagnosed type 2 and hypertension. What else do we know about this gentleman? He's married with 2 teenagers. He's a professor. Their BMI is 32. Started on metformin 500 milligrams twice a day. Father died of kidney failure secondary to diabetes. Okay. 47, type 2, hypertension, diabetes. He's on metformin, elevated BMI, and his dad died of kidney failure. So let's take a look based on this. And they're going to do vignettes like this on the exam, and they'll have the vignette up each time you take the question. Because I'm doing PowerPoint, I don't have that option. So you're going to have to commit those details to memory. Given his age and health status, according to ADA 2024 standards, what are his goals? I'm going to launch this poll. Is it blood pressure less than 140/90, LDL less than 100, blood pressure less than 130/80, LDL less than 70, blood pressure less than 120/80, start a statin, blood pressure less than 130/80, LDL less than 100. Given his age and health status, according to ADA standards, what are his goals? All right, if you see me looking to the right, I'm looking at your votes coming in. If you see me looking to the left, I'm looking at the time. Okay, we got it. Let's close the poll and show your results. So 16% of you said A, 68 said B, 16 said D. So what is the best answer? The best answer is B. He has hypertension, he has elevated BMI, he has diabetes. So he's at risk for cardiovascular disease, and he's over the age of 40. And for people in that situation, we would say, get that blood pressure. The ADA standards for blood pressure is for all people less than 130/80. And then, of course, we individualize that, but that's the generalized standard. And for people at risk of cardiovascular disease, we want that LDL less than 70 and also half of what it currently is. So people with diabetes are generally started on a statin. Anybody over the age of 40 is started on a statin, actually. And we just would say, is it a moderate intensity or high intensity statin? In addition to nutrition therapy, of course. So everybody with diabetes is referred to a dietitian, registered dietitian nutritionist, and also to a DSME program to see a diabetes education specialist. Okay, so that's the best answer, and 68% of you chose that. So great job. This is just stuff we memorize. He says finding time to exercise is challenging due to his work schedule. Using a trans theoretical model, what stage of change is he in? A, contemplation, B, cost versus benefit, C, pre-contemplation, or D, denial? And denial is that place in Egypt, that river in Egypt. Is he hanging out there? He says finding time to exercise is challenging due to his work schedule. Using the trans theoretical model, what stage of change is he in? I'm going to close the poll. Great job, team. So 50% of you said contemplation, 38 said pre-contemplation, 13% of you said denial. All right, let's take So the trans theoretical model is readiness to take action. It's a readiness theory. And let's see where he's at in his readiness. He says finding time to exercise is challenging due to his work schedule. So is he contemplating exercise right then? Just put it into straight old English. Is he contemplating exercising? No. Contemplating would say, I really want to exercise. I'm just trying to figure out when can I work it in? That's a contemplation. Pre-contemplation is, I don't have time to exercise. You see what I'm saying? He's just like, put the brakes on. I don't have time to exercise. I'm too busy. So he is in pre-contemplation. He's not in denial. Denial, I mean, he could be in denial, but denial is not part of the trans theoretical model. Trans theoretical model is pre-contemplation, contemplation, action, and so forth. So, don't overcomplicate this theory because I think it kind of throws people for a loop. Just say, is he thinking about doing it, or is he before the thinking about doing it? And we could use motivational interviewing here and say, oh man, it sounds like it's really hard to find time to exercise due to your work. Is there any type of activity you love doing? And he might say, I love bike riding. And we might say, well, is there any way you could work bike riding into your schedule? Is that something you'd be interested in? And then he might say, well, actually, my son has been bugging me to bike ride, and maybe we could do that on the weekends. And that's how you would move them out of pre-contemplation to contemplation. And that's what we do with motivational interviewing. Now, you might say, how do I know all this stuff? Well, I've got great news for you. And I just recorded this last, 6 months ago. I put together a program called Behavior Change Theories Made Easy. And it turns out I have my master's degree in behavior change. So this to me comes very naturally. But if you haven't, been exposed to this, it might be a whole new language you're learning. So for all healthcare professionals who are coaching individuals to support healthier self-management or taking this certification exam, where do you find this? Free webinars, and it's under Behavior Change Theory Made Easy, right there. Click on it. You can start listening to it immediately. You can listen to the podcast. You can listen to the webinar. And then you could look at the handouts, and the handouts could be a study tool for you. I want to support you on this journey. And and then when you have this information, then it can really help you in your practice too, to maybe change the way you're doing stuff. Maybe you try a new approach. Okay, we're still on this professor. He requests information about healthy eating. Which meal planning approach best suits this individual until he can see a registered dietitian? Is it A, very low calorie diet? Is it B, eliminate all concentrated sweets? Is it C, eat 3 meals a day with snacks in between? Or is it D, the plate method? So every person with diabetes needs to see a registered dietitian. Exclamation point, bold, all caps. But as I'm a diabetes nurse specialist, if they ask me about food, I'm not going to say, I can't talk to you about that. I'm going to give information that matches evidence until they can see the registered dietitian, right? So we have to be knowledgeable, whatever our profession is, about nutrition therapy and different methods for healthy eating. I'll take a few more seconds. Okay, I'm closing the polls because you all are on fire and share your results. 94% of you chose the best answer, which is plate method. So how do you find this information out? Well, in the standards of care, they have a whole section dedicated to lifestyle, and there's a consensus statement on nutrition. On that big book, the desk reference, there's a whole chapter dedicated to nutrition. Also, we have a webinar that's led by registered dietitian nutritionist specialist on nutrition therapy in level 1 and 3, and we have a 4-hour segment on it. So there's different ways to gain this knowledge. But we really want to focus on evidence, and plate method has great evidence that it's a approach that works well for individuals as far as comprehension. And it's great getting started till they can get a more individualized meal plan with a dietitian. All right, let's do another one. So get your calculators out. JL uses an insulin pump and is carb counting using an exchange list. Typical breakfast includes half a banana, cup of milk, 2 tablespoons almond butter, and a piece of whole grain bread. LS's insulin to carb ratio for breakfast is 1 to 12. For lunch and dinner, it is 1 to 15. Based on this, how much insulin does LS need? Well, JL. How much does JL need for breakfast? So they use an insulin pump for carb counting. Typical breakfast includes half a banana, cup of milk, almond butter, whole grain bread. Insulin to carb for breakfast, 1 to 12. For lunch, 1 to 15. How much insulin does JL need for breakfast? 3.5, 3.8, 3.0, 2.8 units. I'm gonna watch it. See what y'all say. Okay, thank you. I'm going to close poll. And will there be a question like this on the exam? I think so. We want to be prepared for it, like counting the carbs a person's eating, knowing what the insulin to carb ratio, and figuring out based on how much carbs they're eating, how much insulin do they need. Okay, so let's count it together. They have a half a banana, that's 15 grams of carb. This is using exchange. 1 cup of milk is 12 grams in the exchange list. 2 tablespoons of almond butter is protein fat. We don't count it as a carb. A piece of bread is 15. So what do we have? We have 42 total grams of carbohydrate. Now, their carb ratio, insulin to carb ratio for breakfast is 1 to 12. So we take 42, we divide it by 12, and their total needed dose is 3.5 units. So let's see what you all chose. 46% of you chose the best answer. The next best answer came in at C, and then many of you chose B, which is 3.8 units. So make sure you're using the right divisor. So this is breakfast, it's 1 to 12, it's not 1 to 15. That's really important. And then if they're saying exchange list, milk is 12 grams of carbohydrate. So you add that up, divide by their insulin to carb ratio, and then you get your answer. And 3.5 is the best strategy. Now you might go, well, how do I get more practice on this topic? And again, in our online university, we talk about this a lot. I talk about it In the boot camp level 3, I have a bunch of insulin courses. In our virtual or San Diego conference, we do a lot of calculations of insulin to carb ratios, and we take a close look at carb counting. And also in our boot camp, we talk about this. So there's different, and they're level 4, and I'll show you what those levels are in a minute. Okay, you're doing so great. We're almost there. Question 4. Metformin is an anti-diabetic agent different than that of sulfonylurea drugs. Some features of the drug are that it what? Stimulates insulin secretion and increases hepatic glucose production. B, causes hypoglycemia. C, lowers hyperglycemia in persons with diabetes, but does not lower blood glucose levels in people without diabetes. D, results in weight loss and can cause kidney damage. Metformin, an anti-diabetic agent different than that of sulfonylurea drugs. What are some features of metformin? Stimulates insulin secretion and increases hepatic glucose production, causes hypo, lowers glucose in people with diabetes but not people without, results in weight loss and can cause kidney damage. Okay, I'm going to close the poll, show you results. So 14% of you said A, 57% of you chose C, 29% of you chose D. What is the best answer? And let's just take a look at A, because this is a really great example that both parts of the answer need to be right for the whole answer to be right. So maybe we don't know what metformin does. We just are kind of guessing. It could stimulate insulin secretion. Actually, it doesn't, but we don't know that yet. We'll talk about that in a minute. But no diabetes medication would increase hepatic glucose production. What does that mean in English? Raise the blood sugar, tells the liver to release sugar. No, that is, not what a medication for diabetes would do. So even though this is a juicy answer, because the first part sounds good, the second part negates that. So you go false, right? This is a false answer. So guys, even if you're not sure about the medication, many times there's clues in the answer that helps you figure out that an answer is wrong. And sometimes that's enough to get you to a better answer. Okay, so that's false. Nobody chose cause hypo because metformin does not cause hypo. Great job. And then a lot of you chose results in weight loss. So metformin is considered weight neutral. Generally, maybe people stay the same. They might lose a little bit, but it's really not considered a weight loss medication. And it does not cause kidney damage. I'm so glad that some of you chose that so I could say that loud and clear. Metformin, we need to have a GFR that's adequate. Like, we don't use metformin for people with a GFR less than 30, under 45, we're cautious. But if a person has an adequate GFR and they go on metformin, it actually will protect the kidneys because it's lowering blood sugar. So it's weight neutral. It does not harm the kidneys. We just need to make sure that the kidneys are functioning adequately to clear the metabolites of metformin, making sure that GFR is adequate, but there's no kidney damage that's caused. There's some mythology that's happening out there. So the best answer after you got rid of all the false answers is C. And most of you chose that. Great job. So how do you increase your knowledge of medications? Medications, be familiar with the most common medications on these medication pocket cards. And the way I put this together is I have it by class. You want to know what medications belong to what class, what the names of the medications are. Be familiar with generic. They'll usually put generic with trade in parentheses. And then the considerations. Be familiar with all those different aspects. And if you are comfortable with the knowledge on this card, it's going to really help you succeed at the exam. Okay, last one. Oh, wait. I had the question of the week on my app, and I also had the medication pocket cards on the app. So you can access them anytime. And the pocket cards on the app and my website, I can automatically update as soon as there's any changes. So I keep them completely up to date. Like, they just approved Farxiga for children with diabetes at SGLT2, and I added that right to the app Pocket Card in my website, Pocket Card. So now there's 2 approved SGLT2s. The Jardiance is approved and Farxiga for children with type 2 diabetes. Okay, last question. A person with type 2 is on twice daily dose of basal bolus insulin. They wake up with morning headaches. If the fasting plasma capillary glucose is 291, we advise a person to A, increase the evening dose of basal, increase morning dose of bolus, check 3 a.m. blood glucose, eliminate bedtime snack. They have type 2 on twice daily dose of basal bolus insulin. They wake up with morning headaches. Fasting blood sugar is 291. What is the best action? Increase evening dose of basal, increase morning dose of bolus, check 3 a.m. glucose, eliminate bedtime snack. Okay, I'm going to close the poll and show you results. So the 60% of you said, hey, let's crank up the basal. 35% of you are more cautious. Let's check the 3 a.m. blood glucose. And some of you said, hey, get rid of that snack. So let's just break this down a little bit. This is a more complex question. And they're on basal bolus insulin twice a day, but they're waking up with morning headaches. Is that significant? It actually is. A person on insulin, if they're waking up with morning headaches, that's a sign that their blood sugar is going too low overnight. People who have low blood sugars overnight wake up with morning headaches, vivid dreams, they wake up to eat, all signs of nocturnal hypoglycemia. And so what action can we take? Would we increase the evening dose of basal insulin? No, because if we increase that evening dose of basal insulin, that middle of the night blood sugar is going to drop even lower. And then what happens when our blood sugar drops low during the night? We get rebound hyperglycemia, also known as SIMOGI, where we release all these counter-regulatory hormones to crank our blood sugars back up. It's life-saving. But that's why that morning blood sugar is so elevated, because the body recognized blood sugar is low. I better release all these counter-regulatory hormones to kick them back up. And so this is so important to, catch that nuance that morning headaches are also coexisting and that we don't want to increase the basal. So the best answer that 35% of you chose is check 3 a.m. blood glucose. Of course, we would say, hey, get them on a CGM. Let's see what's going on 24/7. But still, we want to see what is happening in the middle of the night. And if we confirm that they're going low, let's reduce the insulin at night. We would reduce the basal at night to prevent that nocturnal low, or see if there's something else happening that we're not aware of. So I, of course, would like an answer that says start them on a CGM, or I'm looking for the answer, decrease basal insulin at night. But that answer is not available to me, so I have to choose the best answer, which is 3 a.m. blood glucose. So how do you learn more about this stuff? Again, can't really find it in books too much, but our online university, our levels 1, our boot camp level really goes over this in more details and gives you lots of opportunity to practice. So let me just orient you to how we've structured our online university so you kind of know where to go. This is our online university. So level 1 is our fundamentals, and it's not basic at all. It's not, just like that's elementary. No, it really goes over fundamentals, setting up a scaffolding for the content to come. And you could see I go over pathophysiology, nutrition, medications, insulin, crises. And then level 2 is where I break down the standards of care. So I go through the standards of care, I read them every year, and I say what is most important, what has been changed, because since I read them every year, I know what's been changed. And I highlight it in these programs. Super helpful. Like level 2 will really catapult you to success with this exam. And then level 3 is like right before you take the exam, do our boot camp. Our boot camp, I pummel you. It's not easy at all. I'm going to go through the content quickly. We'll do at least 10 poll questions per class, plus there's questions after class. Plus, I give you an exam with, like, I don't know, 60 additional questions. So you get to practice your test taking skills over and over and over again. Oh, wait, here it is. It's 48 questions, boot camp 9. Yeah, I want you to succeed at this exam. And of course, I want to provide you with great information. Now, level 4 is also an option. You could see I have a whole series dedicated to insulin calculation and pattern management. If you want more on calculation, glucose mysteries for type 1, type 2, basal bolus therapy, I kind of put you in my head and walk you through how to figure out the best approach to insulin therapy. I encourage you to join us live in San Diego. So Dr. Diana Isaacs, really international superstar. She's a pharmacist on technology for diabetes, insulin management, taking complex information and really making it understandable. This course, because we co-teach it, is exciting and dynamic, and it's a great environment. And then on the third day, we have Ashley LeBrier hitting nutrition for 4 hours. The thing about this exam, we know about 70% of people pass. So you want to be part of that, where you feel like you're walking into this exam feeling ready, and knowledge translates to confidence. And the more, the information you've acquired and you've applied it and you've taken those practice test questions, the more likely you are to succeed. And here's our CDCES BC-ADM success page, and this is Melissa and this is Carolyn. They sent in their pictures and they shared their testimonials of what their journey was like and how they prepared to succeed. And we also have a really great Facebook study group, and it's very interactive. People join this certification exam study group and they'll say, I got this question wrong. Can you all help me figure it out? And the group will come in and give them ideas on how to get to the best answer. And plus, I post little information about different strategies you can take or classes that are coming up to help support you on this exam. And it's a great place where people share that they've passed the exam and they give you some insights and support for the next steps. So I hope you can join that Facebook group. It's so great. I love hanging out there too. And then, wow, we have other social media that we post on that I would encourage you to take advantage of and sign up for, because we do that question of the week on Tuesday. Thursday, I do a rationale of the week where I tell you, why that was the best answer, to kind of get you in that framework of test taking and preparation for the exam. I know I've mentioned this before, that you're a super achiever. I know that you do everything you can. When you set your mind to it, you're going to utilize the resources that are out there. And, we believe in your success, and we believe you're going to do great at this exam. And even worst case scenario, you don't pass, right? Let's just go there for a minute. Think about all the knowledge that you gained on the journey. And that's what's most important, because that knowledge you gain translates into better care. And ultimately, that's why we're taking this exam. If you have any questions, please feel free to email us. You can go to our website. You can phone us. We pick up the phone. We are here to serve you on this journey. So I want to thank you so much for joining us. I'm going to hang out after class to answer your questions. And Jennifer asked a great question that would probably benefit everyone, so I'm going to go ahead and answer that on the recorded version. Can you review one more time what activities can be included in the 1,000 hour log? So we have to accumulate that 1,000 hours over 5 years, 200 hours in the year before we take the exam. So it's any diabetes self-management, education, and related activities. So what if I'm looking at a person's chart before I meet with them? I'm calling the provider, I'm calling the pharmacy, I'm documenting, I'm following up, I'm reaching out to the person, I'm developing curriculum, I'm developing handouts and worksheets. All that time counts. What if your position is a diabetes educator and you work 8 hours, the 8 hours count, because your job is to provide diabetes education. So you don't need to just say, oh, I saw this person for 1 hour, I only get 1 hour. No, it's all the activities surrounding the work that you do. So I think, what if I'm a floor nurse or, my dietitian, I work on the floor and I see certain people with diabetes. Well, the people that I see with diabetes, I would count those hours and the work that went into preparing for that visit, documenting a visit, calling, and all of that. So it's kind of a general ledger of time spent doing diabetes self-management education. I hope that helped. Yeah, and if you have any questions in that handbook, they really detail it out a lot more. Okay, well, I'm going to press the stop recording button, but thank you so much for joining us, whether you're joining us live or recorded. We so appreciate your participation in this webinar. We repeat it throughout the year, and you can listen to it again anytime that you would like. It's free and available. So thanks so much again. I'll hang out if there's any other questions, but for now, this is Beverly Thomassian signing off. Thank you.